Hi, my name is Renee Keene. I'm a United States University Family Nurse Practitioner student, and I will be recording this video. It's for my first exam for one of my classes. I will be uploading it to YouTube in an unlisted manner, and my professors, myself, and my school faculty will be viewing it. Do you consent?
Yes, I'm Michelle Phillips. Give my full consent.
Okay, wonderful. So, just a rundown of what we're going to do today. I'm going to be taking a comprehensive physical or comprehensive health assessment of you. We'll be going over things such as your past medical history, immunization history, and social history, and etc. It should take about 20 minutes of your time, and then after that, we're going to be doing a physical exam. Okay? Okay. So just for the record, what is your first name and date of birth?
Michelle, and I was born 11/13/1984.
Okay, great. Did you come with anyone to this appointment?
No.
No? Okay. So what brought you in today?
It had just been a while since I had a physical, so I thought I'd catch myself up.
Okay. When was your last checkup?
Honestly, I think it was like September of 2017. It's been a while.
Okay. Now, do you consider yourself healthy?
Yes.
Okay. Do you have any concerns that you would like me to bring up right now, or?
No, the only thing maybe we could talk about is insomnia, but other than that, there's nothing alarming.
Okay, great. Have you had any recent lab work done?
No.
No.
Not since my pregnancy.
Okay. When were you pregnant last?
I gave birth in May of 2017. May of 2017.
Okay. Any recent hospitalizations? Any recent surgeries?
Last surgery was my C-section in May 2017.
Okay. And any recent ER or urgent care visit?
Not for me.
Not for you? Okay. So we're going to start with your immunization history. If you can, give dates if that's possible. So are you up to date with all your immunizations that you're aware of?
Yes.
Okay, great. Do you get the flu shot annually?
Every year.
Great. When was the last time?
September of 2018.
Okay, great. Now that you can recall, your parents took you and got all your shots as a child? Okay, wonderful. So allergies. Do you have any known drug allergies?
The only one that comes to mind is I have a reaction to Norco.
Okay.
So I try not to take that if it's an option.
Okay, what was your reaction?
I break out in hives on my face.
Okay. How severe would you say that reaction
obviously,
was?
it depends on the dosage, but they had to give me Norco as a part of the treatment for my C-section, and I broke out in such bad hives that they ended up having to give me Benadryl to counteract that.
Oh, wow, okay. Have you ever been hospitalized for this reaction?
No.
No? Okay. How do you, so Benadryl is how you treat it?
If I take it, I try not to take it.
That's how you prevent it?
Yeah.
Okay, wonderful.
But if I do, then yeah, I have Benadryl.
Okay. Now we're going to move on to do you have any seasonal allergies?
No.
No? Okay. Cat allergies, nothing like that?
No.
Okay, great. So we're going to go into your social history. What do you do for a living?
I'm a director at a company.
Oh, okay. Now, do you feel like there's a lot of stress in your life?
Yeah, but it's all balanced, so I feel like I have a nice balance between
work-life balance going on. Good. So what's your highest level of education?
I have my bachelor's.
Okay, good. And do you have good support at home?
Very good.
Okay. Are you married, single?
Married.
Okay. With how many children?
One child.
Okay.
I'm so sorry. We have two children, but one of them doesn't live with us. We have one child and two of us.
Okay. Now, recreationally, do you consume alcohol?
Yes, but very few and far between. Not even barely a couple times a month.
Okay, so when was your last drink?
New Year's.
New Year's, okay, great. And you've been abstaining ever since? Okay, good. What about diet and exercise? How's that?
It's very good. I'm very hardcore into the ketogenic diet, and I exercise 4 to 5 times.
Do you use drugs recreationally at all? Okay, great. And I think I forgot to ask, do you take any prescription medication?
No.
No? Do you take anything over the counter? Any herbal remedies?
We take Unisom to help sleep, but
nothing else. Okay.
And maybe sometimes ZQL. It's all to help sleep.
Okay. Now, we're going to go on to your sexual history. And now, this is a safe space. So, some people get a little uncomfortable with these questions. So, just let me know if you know an answer. We can come back to it, okay? So do you have any concerns about your sexual health at this moment?
No.
Do you have any concerns about your menstrual flow?
It seems to be becoming more and more irregular as I get older, but that's actually pretty recent in itself. It seems like it takes longer to get here, and then I have it for a shorter period of time, and I didn't pass, but nothing alarming.
Nothing
It hasn't stopped altogether or anything yet.
Okay, great. Do you get it monthly?
I do.
Okay, great. And are you sexually active at this time?
Yes.
Do you have any concerns with that? Do you have any painful sex? Any?
No.
No, doesn't hurt.
No.
Okay, great. Are you on any kind of contraception?
No.
No. What do you use? What for birth control right now?
We don't.
Okay, great. Are you wanting to get pregnant?
Yes, we're not actively trying, but we're also not being careful.
Okay,
It just
great.
sort of, if it happens, it happens.
Now, when was your last gynecological exam?
Unfortunately, it's been a while. I can't even recall a date. At least sometime in 2017.
Okay, great.
Maybe, let's say, the summer of 2017.
Okay, so just a little tidbit here. It is important to get your yearly PAP exam and a gynecological checkup just once a year, just to make sure everything's going okay. So we will be referring you to a gynecologist. And so you don't recall your last pap smear
No.
either? Okay. Any history of STIs, which is a sexually transmitted infection or disease?
No.
No? Okay, great. And how many times have you been pregnant?
Once.
Once? Okay, great. And any complications?
No.
Okay. Now this is a portion where this is mainly like a yes or no. I'm going from like head to toe, just asking you questions about your systems, okay? All right. Have you had any recent fever chills, weight loss, or weakness out of nowhere?
No, not out of nowhere.
No.
The weight loss was over a period of months because of keto, but nothing alarming.
Great. How much weight did you lose?
I weigh 50 pounds, basically.
Oh my gosh. All because of the keto diet?
Yes.
That is amazing. That's good. Good for you. I'm very proud of accomplishment. Now, have you noticed anything, new moles or rashes on your skin?
No.
Any hair, nail changes?
No.
Okay. Do you do a yearly or do you do a monthly breast exam?
Yes.
Okay.
Self.
Self breast
Yeah.
exam. Okay. And you've been taught the correct way how to do that?
I think so.
Great. We'll go over that in your physical exam. I'll show you how to do that. No itching or hives out of nowhere
No.
that you saw? Okay. Now, have you had any recent like headaches of unknown origin that you know of, or head injuries?
No head injuries. The headaches, maybe, like migraines. But again, I always attribute that to either lack of sleep or maybe work's just a little bit stressful that day. It's never anything that is long lasting or alarming.
Okay, good. Any dizziness or fainting that you've experienced?
No.
No. Okay, and then do you wear glasses, contacts?
No.
No. Okay. Have you had any vision changes, double vision, blurry vision?
No.
No, not even at night.
No.
Oh, okay, good. When was your last eye exam?
Actually, just recently, I had to renew my driver's license and they give me an eye exam.
Good. By a doctor?
No, it was by.
When's your last eye exam by a doctor?
Oh, I don't know. I don't know years.
Really?
Mm-hmm.
Okay. Okay, so
But I passed the DMV eye exam.
Okay, that's great. I'm glad that they would have caught something if you didn't pass, but you should try to schedule a annual exam just because there are ages related changes that happen to your eyes. Now, have you had any hearing issues that you know of, like ringing in ears?
No.
No. Okay.
Nothing like tinnitus. No.
No, like any discharge pain?
No.
No. Okay. Have you had any recent congestion in your nose, cough, swelling of glands or lymph nodes?
No.
No. Any sore throat, hoarseness, cold cough, mouth sores?
Nothing alarming. I get the occasional cough during winter.
Okay.
Nothing. I take a cough drop and then be fine.
Okay, great. And then, how are your teeth and your gums? Like, when was your last dental exam?
Actually, it was pretty recently, sometime over the summer.
Okay, good. They all checked you out?
Mm-hmm.
Okay, good. Dental and gum health is very important, so it's also too important to always go to the dentist annually to get that teeth cleaned and checked. Um, do you have, like I said, any like recent like lumps in the neck, swollen glands that you're not aware like where they're coming from, or
No.
Okay, great. Do you have a full range of motion of your neck, like any like recent stiffness or
No.
Okay. Now, for the heart, have you had any chest pain, tightness, shortness of breath?
No.
No. And have you ever been diagnosed with high blood pressure?
No.
Do you check your blood pressure annually, weekly,
Whenever I
monthly?
do my physical.
Okay, and it's always been normal
Yes.
according to the doctor?
Mhm.
Okay, great. Um, obviously you probably haven't had a heart attack. No, and you have family history of cardiac disease?
My
though?
father
Okay.
had a heart attack.
And have you had any swelling in your lower extremities, or when you are exercising, do you feel palpitations to the point where you have to take a break?
No.
No? Okay, great. And when you are breathing, you're not having any shortness of breath, wheezing, or difficulty?
No.
No. And have you ever coughed up blood?
No.
No. Okay. Are you having any issues with gastro reflux?
No.
Gastric reflux? No. Do you take any antacids?
I don't.
You don't? Okay. Um, any changes in appetite?
No.
Okay. Any?
That's not expected with keto.
Okay, great. Any recent nausea, vomiting, diarrhea, and/or constipation issues?
No.
Okay. Have you ever had like any abdominal like GI surgery? Is that
I had my appendix taken out when I was in second grade.
okay? Great. Let's see. And any recent muscle or joint pain that you're aware of?
No.
No. Okay. And no vaginal discharge?
No.
Okay. No. And you already said no painful intercourse. Have you ever had blood in your urine? No. Okay. And I already asked about that. Any burning or frequency when you go urinate either? Okay. I know you said that your mom has a history of seizures, but have you ever had seizures or do you have tremors?
No.
Okay, great. No red or swollen joints?
No.
Any like carpal tunnel type situations in your hand?
Yeah, but it's not diagnosed.
Not diagnosed. Okay, well we can actually get you a referral to the orthopedic doctor, and he can run some tests, and we can do some tests here too. But if you want to see a specialist, carpal tunnel is very common, and it's an easy fix. Now you did say that you are having insomnia, and you take an herbal.
No, it's over the counter.
Okay.
Unisom.
Okay.
Or ZQL.
ZQL, and that helps. Okay, great. Have you tried lifestyle modifications with?
Yeah, it's doesn't matter what time I go to bed. It starts shutting my brain off. So it's sort of just
Okay.
that just helps me. Yeah.
Okay. Any others like any? Do you relate that to any like depression issues or stress issues?
Maybe stress. Maybe.
Okay. Have you ever any like suicidal tendencies?
No.
No. Okay. And anxiety? How about anxiety?
Sure, mild, but nothing alarming. Again, my job is very stressful.
Okay.
So if we have a problematic week with a lot of issues, then that might result in some anxiety, but it's nothing alarming.
Okay. And no unexplained weight loss or gain?
No.
No. And any hot or cold, intolerance?
No.
No. And any recent like abdominal sweating?
No.
Okay. And have you found yourself easily bruising?
No.
No? Okay. And have you ever been diagnosed with any type of anemia?
No.
Okay. And haven't had any recent blood loss?
No.
Okay. Your any like eczema, acne, or any like dermatological skin issues?
I've had acne since since I was in grade school. Nothing, again, alarming, nothing bad. It comes and goes. It's usually hormonal.
Okay, great. I think that about covers our comprehensive health exam. Do you have any other questions for me?
I don't.
No? Okay. So now we're going to move on to the physical exam. So we're going to end this right now, and we will get dressed, and I will come back in the room.
Sounds good.
Okay.